charge on. We commit to do extraordinary things. It's a catalyst for action. To put in the work. To keep trying. It's a challenge. To be smarter and stronger. Charge on. It drives us to be more. To get after it every day. It's time to rise above. To let them know we're coming. Charge on. Charge on.
Hello, everybody. Welcome to Dick Pope Senior Institute of Tourism Study, UCF Rosen Research Colloquium. It's a pleasure to have you all. Today we have two presenters. First will be Dr. Maria Santana, who is Associate Professor of Modern Languages and Literature, College of Arts and Humanities, UCF. And second presenter will be Dr. Boon, Peng, MG, from Healthcare Economist, Assistant Professor, College of Nursing, UCF. His topic is use of secondary data in understanding relationship between diabetes and health-related services. Floor is open to Dr. Santana, please. Welcome our first speaker.
It seems that Dr. Santana is having trouble with her camera.
I am. I am. You can hear me, but my camera is not working. I don't know why.
Dr. Peng, if you maybe could start and I can try to help Dr. Santana.
That's perfect. Thank you.
Okay, let me share my. Put it. Can you guys see my PowerPoint?
Yes.
Yes.
Let me put it in the presentation mode. So, good morning. Thank you so much for the opportunity for me to present my research. I'm going to make this remark or presentation quick. The topic of my presentation today is use of secondary data for health services research. Before joining UCF, I was a health economist working for CDC with the divisions of diabetes. That's the main reason why my research mainly focused on assessing the health and economic outcomes of chronic conditions, particularly focused on diabetes and hypertension among Medicare and Medicaid populations using quantitative approaches. Additions to that, my research also focused on synthesizing and translating data from clinical trials and observational studies into clinical and public health practices. Some of you guys probably think my research is really focused in a particular area, right? Hopefully at the end of my presentation, there might be a common denominator. I think particularly in terms of the quantitative approaches where there might be opportunity for collaborations. So the types of data that I normally use for my research are first the claims data. Sometimes people refer this as administrative data. Pretty much is just the claims that providers or hospital file in order for them to get paid. I'm pretty sure some of you guys probably also hear or heard about the EHR. So the EHR is a little bit different. EHR is more of the medical charts of patients. For claims data is anything related to the healthcare utilizations of patients. Because of that, the data contain private information. So in general, for user to access the data, we do need to get an approver or DUA, data use agreement. And normally we obtain the data from CMS. Some private health insurance company also have the data that the researcher can access to. But for me, I tend to access my data from CMS. Actually, that's one of the reasons why my study population tend to focus on Medicare and Medicaid populations. And when we talk about claims data, and I'm pretty sure we all hear a lot of talk about big data. This is truly a big data. I'm talking about millions of observations to billion with a B. So it really just depends on which particular data set that you access to. And the second data type of data that I normally use is survey data. I think we all use the survey data. Once again, CMS and CDC collected a lot of survey data related to health. And for some of you guys, you might even use a sensor data, especially for special or geographical related study. So that's sort of the data that I normally use. One of the reasons why I use the survey data in particular because it's publicly available. I can use it, I can just download it and use it and look at the data as it is readily available to me. I'm not going to talk about systematic review, just systematic review, right? We all have the common tools that we use to get the peer review papers in order for us to perform the systematic review. Yes, as a health economist, I have to admit we do perform cost study. Obviously, there's various different types of cost study. I'm not going to talk about it today. I'm mainly just sort of give you guys an idea some of the cost study that I perform in my area. So the first example, just my recent publication, we examine Medicaid, medical costs associated with hypertension by diabetes status among women in Alabama. What we found that the hypertension associated excess medical expenditure by diabetes status was substantial. If I remember right on top of my head, those with hypertension and diabetes, their medical expenditure per year, excess medical expenditure per year per woman was about 2,000 to 4,000. The question is, even in the health sector, why you need the cost study? Why should I care? What are the implications, right? I'll give you a quick example. For example, diabetes. I'm pretty sure some of you guys probably know there's diabetes prevention programs or what we call lifestyle change programs. And some of you probably familiar with it. CDC has what we call a National Diabetes Prevention Program. The program, to implement that program per person, it is about $500. However, the medical expenditure associated with diabetes per person annually right now is about 9,000 to 10,000. So I do not need to be a scientist. If I present you the data, right? The prevention program, $500. The burden of conditions, 10,000. It sort of give you an idea why the interventions is important, so to speak. Of course, this is sort of a behind the envelope calculations where you get a sense of your ROI sort of way. Again, there's various different types of cost study, but this is just sort of a quick way of explaining that, so to speak. In addition to that, we continue from that. Another paper that I want to talk about is just we examine the prevalent and medical expenditures of diabetes-related complications among adult Medicare enrollees with diabetes in 8 U.S. states. The prevalent medical expenditure of diabetes-related complications vary by the types of complication, which is not a surprise, right? And then the eligibility criteria, the reason why is because Medicaid enrollee have various different eligibility criteria to be able to enroll in the program, and vary by states because states have options to offer various coverage benefits. And we also found that dialysis and lower extremity amputations were the costlier complication in terms of per person annual medical expenditures. Again, right, in general, what decision maker from my field tend to ask is how many people affected, or how many people we should include for certain calculations or the health burden, and what is the cost, right? If you combine both, you get a total spending or total expenditures. So, and I'm pretty sure the underlying models or the methods that I use probably can be applied universally or across different research areas. So it's sort of a hypothetical example. Let's say we have the data or collected the total spending of visitors visited Orlando last year. So if we have the demographic informations, let's say sex, gender, race, ethnicity, so on and so forth, we will be able to quantify how much or what is the expenditure or spending by gender, sex, race, and ethnicity. So that's part of sort of why sometimes when we talk about cost related study, that's sort of the things that we are interested or we try to do. And here just another two example research that using survey data. So we examine factors associated with avoiding healthcare among Medicare beneficiaries with type 2 diabetes. We found that a high proportion of Medicare beneficiaries with type 2 diabetes choose to avoid healthcare. Actually, it was about 25%, surprisingly high, but on average in United States, it's about 40%. And we found disparities in care-seeking behavior by race, ethnicity, and education level. Because of that, we recommend clinical interventions, particularly to improve the patient and provider communications, and education outreach are needed to decrease the numbers of Medicare beneficiaries who avoid healthcare. Certainly, for my example, we examine the factor associated with the health behavior. In your field, it could be factor associated with any other related behaviors. I'm pretty sure the underlying models or the technique that we use to stratify the result likely will be very similar. Another quick example that I want to show you is that this is we try to understand the relationship of discrepancy between perceived fall risk and physiological fall risk with repeated fall among Medicare beneficiary. We found that there's a high proportions of Medicare beneficiary with high fear of falling and high physiological fall risk. And I think it was about 40%. And those with high fear of falling, high physiological fall risk was associated with repeated fall, compared to those with low fear of falling, low physiological fall risk. So this is very specific, targeted population. What the reason why? So that we will have a targeted intervention for these at-risk populations. So I'm not going to talk about this a lot. Actually, I'm not going to talk about it. The reason why is because pretty much when we talk about systematic review, we pretty much using the same technique. So what I do want to talk about a little bit more now that I recall is focus on the claims data a little bit. In addition to the cost-related study, we also estimate the number of inpatient stays or the ER visits. So sort of look at the count data, try to identify, for example, here, whether or not a patient with diabetes have a higher number of ER visit per year and per person. And I'm pretty sure the underlying model that we use can be applied in your field. For example, here we tend to use the negative binomial, zero inflated negative binomial model to perform those study as well. So I am done with my presentations. I think you'll be probably open to the floor if you have any questions.
I have two questions, if I may.
Yes.
One, the data, is this free available data or you have to pay for the data?
So for survey data, I think in general, is publicly available. So for example, a lot of the data that I use for the survey data, they are publicly available. So you can access them through CMS website or CDC website. For claims data, yes, it requires DUA, and yes, you do need to pay.
Okay, thank you. The other question is related to, for example, if I like the example that you gave with regard to Orlando. If we have an idea about how many visitors with diabetes visit Orlando, we can, estimate the potential cost involved per year on our healthcare here in Orlando, and also we can improve the protocol so to minimize those costs both at the attractions and hotels and so on. Is that something that you were referring to?
Yes, that was sort of my point. So the whole point about this is that as long as we have the data, right, depending on what sort of data, and you have various variables or characteristic of the visitor, we should be able to sort of analyze or estimate the cost associated with certain behavior. Hopefully I answer your question.
Yes, and then finally, the behavior. I mean, I noticed from network theories that especially in healthcare, it moves from the infectious disease focus to more behavioral focus, and that is, I think, very important because in our field we do a lot of analysis about behavior. So it is crucial to understand how this particular behavior in terms of the diabetes, for example, can affect, satisfaction of our visitors, and also can become a strain on our hospitality infrastructure.
Yes.
That was my last comment. Thank you.
Thank you very much, Dr. Boon. Thank you for joining us. Dr. Santana, floor is yours. Your presentation title is Interpreting Messages of Collaboration Among Interdisciplinary Research, Women and Research Globally.
Thank you for having me. Can you see the presentation?
Yes.
Well, it's a pleasure to be with you today and to share some of my journey as a researcher. I first wanted to talk a little bit about what I do so that you understand where I'm coming from. And that is that I am an interdisciplinary researcher. The field of women and gender studies studies social class, sexuality, race, ability, place of origin, ethnicity, and age, among many other things. So you can imagine if you start thinking about all those areas and you put a field next to them, pretty much is the whole university. Our curriculum comes from many different disciplines because we are interdisciplinary in our curriculum. So although we have courses that are WST code, we also take courses in existence from sociology, from English, especially literature, from psychology, from communication, philosophy, history, and STEM. So for example, around the nation, you might have a director for women and gender studies who is in physics, or you might have a director like myself who comes from the communication field, and that's not unheard of. So imagine women and gender being like water, and everybody needs it to survive. So that's what I like to think. At UCF, women's studies was established about 25 years ago as an area study. Area studies no longer exist. They exist within other disciplines. The only one that remains is women and gender studies. And our offerings are in the undergraduate level. We have a minor in women and gender studies, and we have a certificate on gender. And in the graduate level, we have a certificate on gender, which is very popular, especially on people that are in the work field and would like to learn about gender in the work and HR. We have about 45, over 65 faculty affiliates in campus, and they come from all disciplines. And we have over 20 junior affiliates. Those are graduate students that are either interested in gender or women, or that are following a discipline on that content. We have created about 7 different scholarships for children, many of them for students. Many of them have nothing to do with women and gender studies. So you can have your students apply as well. And we have 3 research grants for faculty. Again, you do not have to be affiliated with a program to apply for those. And as you know, faculty always welcome a little bit of extra cash. I wanted to share with you our website because we do so many things, including we have been working with adolescent girls in STEM for the past 13 years, and it's called SLAM, Science, Leadership, and Mentoring. And this program is very unique because it matches a UCF woman with a 13-year-old girl in the locality. So this year, because of the COVID, we are online. So now we're national. So we have girls from out of state. The girl has one partner the whole academic term so that they have a friend, a big sister to talk to explore leadership, to understand more about growing and changing into a woman. And it's quite successful, and it's also an award-winning program. And we just received funding for the graduate college at UCF for doing a pilot on girls and gaming. So the girls will create a game following their own initiative. We truly believe that girls are leaders on their own. So I'm most famous for my collaboration level and my interest in collaborating with other faculty members at UCF and around the world. Some of my community partners are the Farm Workers Association of Florida, Gen W on leadership, Refuse Center for eating disorders, Second Harvest Food Bank on hunger. That's just to name a few. On their curriculum, I have co-taught or have other faculty come to my class, or I to teach some of their discipline. In their sociology, I've done video diaries and isms. That was very interesting. We had a grant to allow students to explore some of the isms that they face, such as racism or feminism or multiculturalism or ageism. In art, I partner for desktop publishing and visual literacy with the College of Honors and a graphic designer. And in psychology, I have been a guest speaker about the female gaze and the male gaze. I have over 36 honors in the major and 14 theses and 16 dissertations at UCF. So you can see that my collaboration has been all around. Perhaps I'm most known as an expert in gender and women, which is a very big title. So I'm just sharing what people say. Let me talk to you a little bit about my research, my global research. In Latin America, I've done significant work in 3 areas: Argentina, Mexico, and Peru. In Peru, I started with Education USA, which is a program with the US Department of Education. And in Cusco, we created a program for indigenous activism. and vulnerable women. My students helped facilitate a panel and a discussion plus 3 workshops with local indigenous women. We had to have translators for Quechua as well as some translators for Spanish in the case of some of my students. But it was really welcoming to see how the classroom can create a community experience and how many of my interdisciplinary students had no idea, I've never had that situation before. So that was also very interesting. We had a moment of reckoning when one of my students, who is a male, was talking about his mother and what it meant to him, some of the things that she developed in him as leadership. We emphasize the importance of community and understanding one another, and to be very careful about the vocabulary that we use with other people and about other people. Cusco was a phenomenal location because it was secluded, then again, quite developed for my students to understand a different culture, a Peruvian culture. Education USA was also my partner in San Cristobal de las Casas, which is in Mexico in the region of Chiapas. Chiapas is in the border with Guatemala. Chiapas is a highly indigenous population. They have 4 different indigenous groups living in Chiapas with 4 different languages. So I am only a speaker of Spanish, so I needed some help in that area. We work with youth, and again, that's one of my research interests, and we work on their potential for college preparation. Very rewarding experience, very difficult because we think that everybody is at the same level of education, and Mexico has a higher level for their high school students. So their high school students are what we would consider here somebody working on their AA or finishing their associate degree. So that was also interesting to compare in global terms. What are people doing and how are they moving towards higher ed education? In that particular research, it was also important to understand something that later came up in another research, which is the marriage age for women and how it affects the progression on education for girls who are married off at 9 or 10 years old. With the University of Chiapas in Mexico, I worked with the indigenous youth education and girls' marriage. Um, my previous partner has been in Africa, in Nairobi, on the Samburu Girl Foundation. And the Samburu Girl Foundation works with the community to not allow cutting of child brides or having child brides. It is against the law, but people continue with that practice. So the Samburu is notified. They bring in the girl to their sanctuary or their educational facility until the parents can take the child back and allow for a later marriage date. So we study the marriage age and consider that 16 or 17 is a very important age for the girl to be allowed to remain in school, to learn more math, to perhaps learn English, to go back and work better in her community. We are not establishing a different format for their tradition because we understand tradition is their priority, but we're trying to create awareness of how much can a girl's life change if she can stay 3 or 4 years more in school and be married later. Um, this was a very difficult journey to follow because as a feminist and as a defender of girls and women, it is hard to see impositions on somebody at that early age. But at the same time, the University of Chiapas has an incredible team of researchers dealing with indigenous populations and respecting their traditions and understanding their historical path to the reality that they are in today. In the University of Buenos Aires, I didn't work with indigenous populations, but I work with immigrant populations and the importance that they bring as parents. This was a community engagement research. So we were there to observe, pretty much as an ethnographic study, to survey and to also pre and post our participants into understanding what they are learning through our workshops. Um, because they're immigrants and because they're not always receptive, people are not receptive to them in Buenos Aires, they are sometimes left behind. So my research was trying to create for them an awareness of the services that they have available to them in Buenos Aires, to build more of a collaboration between the community and those populations. But at the first time is to create some kind of a bridge for them to talk to me and to allow me to be there. Most of the research that I do faces that issue, that researchers cannot just come in and ask questions, but they have to build some kind of a understanding bridge or initial effort to come into that community and explore a little bit who they are without telling them, oh, you're doing this wrong and you're doing that right and you should do it this way. It is more of a peer to peer. I know it's hard to see it that way because you might say, well, maybe the indigenous population has a really difficult time surviving with their families, but that doesn't mean that they're below me. They're my peer in the sense that we're working together for a better good. Um, Buenos Aires was difficult to work with immigrant populations. We had to go under bridges and find particularly the Bolivian immigrant population that is perhaps worse treated among the other immigrant populations. But if you think about it, being a good parent, it's important. It doesn't matter where you are, who you are, because you're building that community with your children. So we consider that an important task at the time. Um, Also in Buenos Aires, I have been working in the past year with a law center because of a new law called Micaela. And this law is about violence against women. This immigrant, this young woman was killed and in a horrible way. And the response to it was massive. The response to how it wasn't fair, how she wasn't protected, what could happen from now on. Is this the same future for other immigrant women? So I've been working with a group of researchers on this law center and also with the Universidad Católica of Buenos Aires, dealing with violence against women and other cases on this issue. In Russia, I work with the Finance University under the governance of the Russian Federation, and this is in Moscow. And with that, I also did a youth program or a youth research on children in times of war. And for that, I was in Moscow as well as St. Petersburg. One of my areas of research is global women in crisis. And one of the crises that I study are war, present war or past war. This experiment was a little difficult to do just because we were doing World War II. And most of the people that we can talk to today were children at the time. So their recollection of their family dynamics perhaps have been compromised through memory and time. So that's what I mean by being difficult. Not that they were difficult, they were delightful. In Moscow City University, in the Teachers College, I also wrote a paper on global women in crisis, this time through literature and through the representation of women in literature through times of battle or war or famine for Russia. And for the Pushkin Institute, I presented my research on World War II war posters and the representation of women. And I did a comparison with the women at the time in World War II, how she was portrayed in the war posters. and the women in US and how she was portrayed, and also the figure of Rosie the Riveter, um, who was an inspiration for other women to take on a task that usually was done by men, but to support the US government during World War II, bringing in 6 million women to the workforce that never had work outside of their homes. My students often ask me, well, where did those 6 women go when the war was over? And I say, well, they didn't go back home. They probably took a less paying job because most of the high paying jobs remained for those men that returned to their jobs. But it did change the family dynamics, and it is not a coincidence that the 1950s was a rebirth for women to go back and be domesticated, to create products for the home like vacuums and shiny appliances, to bring in women back into the kitchen. It seems to us silly today to think that that would entice a woman, but the definition and the determination of the government and the public sector, including the private sector, to bring women back to the family circle, to protect the economy and take the women out of that inspiration to be a worker and have a position in the workforce was very significant during the 1950s. Therefore, the 1960s does should not surprise anyone on the sexual revolution and some of the things that happened in the women's movement. So those are the things that I like to look upon and study around. Um, I am currently a director for a Fulbright to Argentina. It's called A Woman's Place, Language and Culture Alive in Argentina. And this is a curriculum program working with K-12 teachers as well as UCF professors. We are going to be in Buenos Aires for 4 weeks. And before that, I was the co-director for a Fulbright Haze in Russia called Building Bridges Through Language and Culture. Very interesting, very important to me. I have a minor in Russian studies in my PhD. And as you can see, I have studied Russia significantly and Argentina. So the Fulbright Haze was kind of like a climatic experience, like, woo, now we're going to go over there and do research as a group. I also received a sabbatical this past spring, a type 1A in Alicante, Spain. I was studying women in war in Spain, and this time the Spanish Civil War, and studying women as militants, as soldiers, because they were. Unfortunately, my sabbatical was cut short. I had to return to the States because of COVID-19. So I'm hoping to continue the part that I was not able to do, which was my physical face-to-face interviews um, through the Gender Center for Research at the University of Alicante. I have done a fairly amount of study abroad programs. So these are programs that I do with my students and that they are involved in service learning. So my study abroads are not just learning a language, but learning to help the community, to assist the community, to learn about the community by living with them. So they're demanding, and it's not for everyone, but the students that have attended find it very rewarding. I have been an officer in many professional organizations, so I continue to be interdisciplinary. So I just wanted to share with you some of the positions that I have chaired and that I have directed nationally. And my international presentations have brought me to India, the Trichy, which is in the southern part of India, to Rio, to Madrid, to Amsterdam. Amsterdam was last fall, to Mexico City several times, to Quebec City. I had a grant in Quebec with the government looking at culture and the parameters of language. And again to Moscow in Russia. I want you to know that I'm always looking for collaboration. I think that in the academic community, we sometimes live in silos, and I don't like that idea because I think I want to pick all of your brains because I think you have a lot to offer to me, and I hope I have something to offer to you. So I wanted to finish with the 3 things I stand for, which are collaboration, variety, and commitment. And I'm giving you here my email. So in case you want to touch base later, we can talk some more. Thank you so much for having me.
Thank you so much, Dr. Santana, for a lovely presentation. Any questions or from the audience? You have a Q&A, a little bubbles.
Dr. Santana, thank you for the presentation. I'm not my focus is not women's study, but I bumped into women in my research in Ecuador, and especially was in a group researching indigenous people in the Amazon with the chakra route in Ecuador. And what caught my attention was the power relationship between women and men among the indigenous people, where women has a very prominent role. And they call them chakra mama. The chakra is basically a garden which is related to their traditions, the plants, their values, and the way they see the world. But what struck me is the fact that by being so much immersed in traditions, they have overlooked opportunities in the future. And therefore, while maybe some people like to see them in their tradition, but I felt personally, living under those objective conditions doesn't seem appealing or immersing in happiness as a person, as the way I see it. Maybe I'm wrong, maybe I'm right, I don't know. But the objective, it's a poor environment with a lot of poor conditions, the housing and so on. So I don't know whether that is your experience when you study women, especially under indigenous conditions.
Well, it's true. We value possessions in a very different way. We value facilities in a very different way as they do. And cultural change for most indigenous groups comes in a very small way, slow, not as fast as we might think. One of the things that I have seen as an equalizer is education. Even having 6 more weeks a year for girls to finish and study further, because they can help into their family's progression out of poverty. Poverty is a cycle, and in many cultures, poverty is a reality. But at the same time, I found them incredibly happy, um, healthy as much as they can. I mean, one of the groups that I work in Mexico had only 3 things to eat, because those are the 3 things that they grew: corn, celery, and cilantro. Now, if I tell you that, right, you are going to say, no, I'm going to go to Publix and I'm going to get chicken, I'm going to get this, and I'm going to get that. But that's not the reality that they have. They have what they can grow in their backyard. And they thrive on those 3 elements, which of course doesn't seem to us like a prudent kind of health, or conducive to long lives. Well, sure, they're short, and other things have affected their diet. But at the same time, you can't like introduce like everybody has to have a chicken, because these are communities that believe in the collective. So if I have a chicken, you have to have a chicken. I cannot be the only one with a chicken. So when you start seeing how they build themselves and how they understand the community, you stop seeing the poverty, and you stop seeing that they don't have running water, or they don't have, oh, they have a public bathroom. You don't see those elements as much, which originally shock you. Because in India, and I have been many times, the first time my friend said, don't go, you're going to get sick, it's going to be horrible. I had a wonderful time. But you have to put aside some of the sanitation problems, because otherwise that's all you see. You only see this when you can see like the whole community. So it's difficult, but it's not impossible. It does require you to go in with a delicate point of view, and to understand that your way is not their way. That's what that's how I tried to do it.
There is a question from the audience. Thank you for wonderful presentation. How do you feel about research project on women working in hospitality industry and their challenges? I think there is a need and a great potential.
Yes, yes, yes. There is a need and there's great potential. Hospitality is not the land of men. Hospitality is the land of everyone, including women. So we have to see how it affects women, how women perceive it, how they are perceived. If I'm at 3 a.m. overlooking a counter in the first floor of a hotel and I'm a woman, how am I perceived? Are people going to wait for a man to come in and talk to them? Are they going to be comfortable with me? Would I be comfortable in that position? I think it's very important to treat every member of the community and to understand that in your own field. So, yes, I'm ready.
There is one more question from the audience. Are there different cultures people you have worked with overall open to changes, or is there some sort of pushback wanting to stick to traditions?
I think once you have a relationship with the group, they are more perceptive. The first time I went to Chiapas, I had the elders standing in the back of the room, and these are all men looking at me very weird with their hands crossed. And if I would have run away that day, then I would have never been able to do the research that I have done. So I just looked at them and I thought of my dad, who was a very serious person, but he was a teddy bear inside. So that kept me going, thinking they're my family, they're my dad. And that helped me to, the next time I came, they were more receptive until they never came back. They sent their wives. So when we were working with their hospital, and they were trying to understand their modesty. Not every woman wants to be half naked when she gives birth. Modesty is a very important issue for the indigenous because they're covered to head to toe and they're covered and they don't like to show their legs or their arms. So imagine how they feel when a stranger comes in as a doctor and it's, looking at their bodies and they're half naked. Then nobody wanted to come to do that. And we're thinking, why not? It's your health. And I said, because it really goes against the culture to be in front of a man naked or semi-naked or with a paper outfit. So little things like that, you have to see the big picture. And so when we got them all the supplies that we brought one year, more than $2,000 of supplies, all they could do was cry. They cried for 7 days because nobody has ever come. No stranger has ever come to that community before.
That was the last question. Comment. You worked with so many cultures, you have so many approaches, you have seen so many communities, women and different tradition, and there is this approach for the different culture, and you say you have to see the big picture and how to approach people, but at the same time, based on your presentation, you try to bring little changes, like a little bit more education, a little bit more hygiene, a little bit more approach to health, dynamics between male and female. Now, I would assume, like in so many things, when you introduce the change, there is certain resistance.
Oh, yes, there is resistance. And you also work with a partner within either that community or near that community. So it's not like I walk in as a total stranger, like, hey, you should do it this way or change that other thing. I'm coming in with somebody as a bridge that knows them and that allows me to be there. And that takes time.
So the question is, what did you find more useful to bring the change outside of bringing it in the small pieces? What removes the resistance, if I make sense?
Well, believe it or not, it sounds very simple, but seeing me and hearing me and touching me and me being there is the first blockage of resistance, because I'm not just somebody, in an email. I'm not somebody that sent a video. Like one of the things I did was that they were working on in one of the projects that I work on creating more midwives for that community. But the community woman didn't want to do it. So I had to understand why they didn't want to be a midwife. And then when you start thinking, oh, I'm delivering babies and there's a problem, I'm going to be blamed for it. And if the baby has a leg that it's crooked, they're going to be looking at me. I'm not going to go anywhere. So when you realize what it entails, then you go, okay, yeah. So let's rotate them so that they're not always doing it all the time. Let's find a way to help the community, but not having like, you are the midwife, you face all the life and death situations. It takes time, but believe it or not, that first encounter, and I have been turned away by some people and then they call me back. That's okay. That's okay. I was turned away by the Farm Workers Association in Florida because they are tired of researchers coming in and asking questions and they're never returning. And I say, oh, but you don't know me. I'm very tenacious. And I have been working with them for 12 years now.
So it's
yeah.
It's a by example and sort of follow the logic. What's the core of the problem? So let's adjust the problem. That becomes the reason for resistance.
And listening to them, not just imposing your views, but listening to them and working at the different levels of possibility. Some things are not possible. I want to bring toilets to Samburu Girl Foundation. I still want to partner with engineering so they have water in town and they have to pay for water to be brought to their facility out of town. I want to make that connection. I haven't been able to, and it's been 6 years, but I'm not giving up. I think everybody deserves a toilet.
Yes, indeed. I work in emotions and health, and so that's because there is certain resistance in people when you start talking. And I was just wondering, in your such broad experiences, not just cultural, but dealing with people, how did you go through that, and what were the boundaries? Thank you so much for the wonderful presentation. I don't have any more questions from the audience, but I want to sincerely thank both of you, Dr. Santana and Dr. Peng, for coming, presenting, and sharing your knowledge and expertise with us.
Thank you for having me.
Thank you very much, and we will see you in the next colloquium.